extra second. All right. Good morning, everyone. Welcome to the House Committee on Government Operations and Military Affairs. This Wednesday morning, we are going to get our first look at this year's OPR bill. Welcome, Lauren.
Thank you. My name is Lauren Lehman, General Counsel for the Office of Professional Regulation. Thanks for having me this morning. Excuse me. So we're here today. Usually OPR proposes some language modifications of our statutes annually. And so we're hoping to do some minor revisions again this year. The office itself, just to give folks a brief overview from last year, because we haven't talked in a year or so, but we oversee 51 different professions. We have about 80,000 licensees at this time, and our team consists of 41 folks, 9 licensing administrators. We have about 9 investigators, 5 certified law enforcement, 4 prosecutors, case managers, and a paralegal. So we have a significant enforcement unit. We also have a licensing and policy side, and that includes lawyers such as myself and policy analysts, docket clerks, et cetera. And with all of those, with that team, we oversee both. We're a public safety organization that oversees licensees to ensure that they're qualified, that the public is protected, and we address any complaints that come in to the office. So our core mission is that public protection, but in recent years, we've also been at the forefront of workforce needs, ensuring that our licensing standards are minimum to protect the public, but not creating artificial barriers to entry into the workforce, and adapting to emergencies such as COVID and the summer's flood to ensure that we get the workforce we need that is capable, overseen, regulated, but also available in times of need. So that's what we've done recently. For today's bill, what we're looking to accomplish over the next year are really some fairly minor changes in this year's legislation. We have 2 sections of the statute. One is Title III, which is kind of our umbrella statute. So everything in Title III applies to all the professions we oversee. Then there's Title VI, which has profession-specific chapters. So when you see Title III, you're looking at things like unprofessional conduct, board authority. Those are the umbrella. When you get to Title 26, it's very specific. We're looking at making some modifications to cosmetology, estheticians, those specific parts. So we have 2 changes we're requesting in Title III this year, the umbrella, and one relates to the professional regulatory fee fund. Currently, OPR's budget is at a bit of a deficit. We're talking with House Ways and Means and the money committees about how to address that, proposing a study of OPR's finance model and looking into how to restructure certain aspects so that we address that deficit. One of the things, and not necessarily part of that, but also contributing to that, is that there's only one place in the statutes that specify what fees within the professional fee fund have to be used for. And that is in this section that says that any civil monetary penalties that are charged against a licensee have to be used for the purpose of board education and training. We don't really have board education and training from an external vendor. We do all of that internally. Staff does a new member training and orientation. Recently, we had our enforcement unit do a full day presentation on the disciplinary process for board members and advisors. Occasionally, there'll be a national conference for board members for a specific profession. Often those fees are covered by the national conference, so the National Association. So really, there's no need for those funds to be siloed. So this change in the statute would just strike that section that says that the fees must be used for professional education and training. The fees would still be put into the professional regulatory fee fund. So it wouldn't be diverting licensee monies to another location, or outside of OPR, it would still be with, you know, the licensee's payments, the licensee's fees would still be used for OPR, the regulation of the profession. It just wouldn't be earmarked specifically for education and training. That's section 1. Section 2 of the bill is also in Title III, in that would look to add inspections to a provision of unprofessional conduct, which makes it unprofessional conduct for a licensee to fail to cooperate with an investigation. And this would include inspections. So we have 2 inspectors who inspect funeral homes, pharmacies, barber cosmetic shops, tattoo shops, and I'm sure I'm missing something. And so these folks go out in the field, make sure folks, you know, that the funeral parlor is in compliance with hygienic and other requirements and regulations. Pharmacies, et cetera, are also. And this would unprofessional conduct to fail to cooperate with those inspections, as well as, in fact, it's already unprofessional conduct for investigations.
From Representative Waters Evans.
Thank you. So what happens right now if someone refuses?
There's not really our inspections officers talk to them and try to get them to cooperate. It can be a condition of what initial licensure, but it's hard to make it a condition of renewal. This would clarify that it is clearly unprofessional conduct.
And that would then make it a condition of renewal.
If so, with renewal conditions, then it would give us the opportunity to go through the process of a hearing and due process to deny that license. It gives us the charge under which to pursue licensing.
Okay, because right now you have to kind of be like, oh, well, if it didn't.
Yeah, or
Yeah.
to make up some, not make up, but to use some other legal argument to get at the issue. So
Sure.
we have I think 24 standards for unprofessional conduct. They could probably be charged with failing to cooperate with state law or something along those lines. But it's a more tenuous argument when you get before a judge to say, well, they didn't cooperate because they wouldn't give me this document, or they wouldn't give me this, they wouldn't let me access this area of the store. And then the judge says, well, was that state law or not? This just makes it very clear.
Thank you.
All right, so those are our only umbrella chapter changes. Now we delve into one of our 2 big professions and changes. We're going to work with estheticians. We'd like to work with esthetician chapter. We did reach out to the folks that we know of in the state, our advisors, the schools of cosmetology. We have not heard back. We talked to our advisors a couple of times about the tattoo part of this chapter, but we have not heard a lot of response to the bill. The changes we're making really are not changes to the guidance OPR has been providing these professions over the last couple of years. It's just clarification. We receive a lot of inquiries about, can an esthetician, the current statute says scalp, neck, head. Can an esthetician, like in a spa, do, a full body wrap or something like that? We also received questions of, well, can I give Botox injections? Can I, do an IV? So we really are going in to clarify the scope. And we based a lot of our proposed language on the surrounding states, Delaware, Connecticut, New Hampshire, Maine, Massachusetts, and looked at theirs and used their language to build what we're proposing here. One of the biggest clarifications is to say that it can be other than the scalp, face, and neck, but B, you cannot practice medicine. So practice of medicine includes providing injections, giving IVs. There really should not be any sort of practice of medicine or penetration of the skin for estheticians. And aesthetics is a separate license type, but it's also incorporated into barbering and cosmetologists. So a cosmetologist can perform aesthetics. A barber can perform aesthetics. An esthetician may not do cosmetology or barbering. So it's kind of a Venn diagram of services and scopes. So in addition, the other change we made to this chapter was to allow for the regulation of estheticians, aesthetics only and nail manicuring only shops. Currently, we already look at nail shops and aesthetics only shops and do inspections there. We have those shops register, but there's no clear, we always assume, it was always assumed those would be inside a cosmetology shop or inside a barber shop. We're seeing a lot more independent shops. And to clarify the inspections there and not make, you know, a nail shop comply with all the standards of a cosmetology shop, or to make a aesthetics only shop comply with all the standards of a barber shop. We're clarifying in the statute that there can be an aesthetics and manicuring only shop. That's clear. And so we added aesthetics and nails to the definition of shops. And we also put in prohibitions of saying, hey, if you don't have a Cosmo or a barber or an esthetician license, you should not be performing aesthetics. Hey, if you don't have a Cosmo, barber, or nail technician license, you should not be doing nails. So we also asked for rulemaking authority over those places and the safety standards, et cetera. Again, we already have those rules in place. This just clarifies in statute that they would happen in a solo shop instead of as part of a cosmetology shop or as part of a barbering shop. The other place that we made a significant change was in examinations. So the current statute is very prescriptive of the type of examination we must have, a practical and a written, and it makes it difficult for us to be nimble to changes in the marketplace. So, you know, during COVID in the recent years, it's been really hard to find proctors for examinations to see a practical exam for a cosmetologist. That's an artificial barrier to getting folks who've graduated from school into practice in the field, because we can't find a proctor, you can't take your exam, you can't go on to get your license. We would love to do things like we found a remote provider at this point in time who can do remote practical exams. But to be able to be nimble like that would mean taking some of that prescriptive requirement out of the statute and allowing OPR to do rulemaking on what is necessary and responsive in the field and examinations. And then the last one is, again, just about shop licenses. So that's aesthetics, clarifying scope, clarifying shops, clarifying exams. The next part, nursing, sections 9 through 12, are really just clarifications and again, bringing terms up to date. So the term active practice is no longer really used in the nursing field. It's now referred to as continuing competency or ongoing practice. Our nursing rules that were recently updated reflect those modern terms. And so we propose to revise the statutes to also include those modern terms. The other thing we proposed, and we talked to legislative council about this, is there's some misnumbering and misorganization of the statutes. So currently, even though there's a subchapter for RN regulation and LPN regulation, all the RN and LPN regulations are under the nurse assistant chapter, and we'd like to move them up into the appropriate subchapter. So it's just renumbering. That's not included in the current draft bill, but we've spoken with legislative council about doing that renumbering. We weren't sure if it made sense to put it in an OPR bill or in a technical correction bill. So that would be new changes to that. The next section is for osteopath students. The proposal is to include in the osteopath chapter an exception that's included in the allopathic physician chapter, allowing osteopathic students to perform clinical, to have their clinical rotations in Vermont. Currently, there's no exception for students, so it would require under law students to have a license to do a clinical rotation in Vermont. There's no similar, the allopathic physicians who are in very similar schools pursuing the same career at this point are exempt from licensure requirements. So they can do their clinical rotations in Vermont without having to get a license. This would make that same apply to osteopathic students. I know we have talked with folks in the field about that, and it's highly desirable and supported. So do that. Similarly, radiology, we're making a modification so that residents and interns, which have a special type, license type called a limited temporary license to practice medicine. They can get a radiology specialty so that they too can, in their training, look at radiographs, perform x-rays, do that work that they're training to be able to do independently and will be authorized to do independently once they obtain their physician's license. So this would authorize them to get that specialty and train in that field. So those are those. Those are the minor kind of specific changes. And then our next big change is tattooing and body piercers. Again, in this space, we're seeing that permanent cosmetology is where we used to see it subsumed within cosmetology shops or within tattoo shops. There are now starting to be independent permanent cosmetology shops. And so we would like the authority to create independent shop regulations so that a permanent cosmetologist is not held to the same regulatory standards as a full tattoo shop. They don't have the same risk. It's not that it's just a much broader regulatory scheme that is necessary for those specific practices. And so we're looking to do that and also to update some anachronisms within the tattoo chapter. We'd also like the authority to regulate apprenticeships, to make rules about apprenticeships. We already are allowed, there's already an apprenticeship pathway. We're already supposed to take affidavits and forms, et cetera, about the apprenticeship and pre-approve them. This would give us the authority to regulate how those apprenticeships should be set up. We've heard from a number of folks that there's some abuses in the industry where tattoo apprentices are being held way beyond their apprenticeship time because their supervisor won't sign off on their hours. They're getting free labor. They don't want a competitor out there. They don't want to pay the employee. So they just maintain their apprentice kind of in this long-term situation. We would like the authority to make rules, to set up some boundaries about that and to level the playing field. And then the rest of the changes are made to update the definitions, includes permanent cosmetics shop regulations, so that, again, we have the rulemaking authority. The shops are now include a potential permanent cosmetics only shop. We're eliminating redundant definitions in the tattooing chapter. There's a disciplinary action and a special panel definition in tattooing, but as I spoke about earlier, we already have those in Title III. So we already have umbrella rules that apply to tattooing, and having them specifically in that chapter make it redundant and create some conflicts there. So we're also asking, so from time immemorial, we've been told that the laws say that we need to have a public health or medical advisor to the tattooing profession, chosen from a list provided by the Commissioner of Health. We have never been able to fill that spot. And so we've just had a vacancy. We'd really like to fill that spot with a permanent cosmetologist. Because we're now regulating that space, we would want to have one of their advisors in that technical and professional knowledge instead of having the doctor. We would, of course, consult with the Department of Health on any hygiene rules, any things about public health in the tattooing space that need to be addressed, as we do with cosmetology, et cetera, which have hygiene adjacent concerns that don't require Department of Health oversight. And then I think I detail in here in the section by section, just some licensing process amendments. So we're changing, there's a lot of direction for OPR, for applicants to submit a form to OPR. We don't have forms. We haven't had forms since 2017. We're an online technology only electronic base. So we're just updating again that language to make it more nimble and reflect OPR's application current processes. And we made some changes to the licensing section for shops, again, to specify that, permanent cosmetology can take place in a tattoo shop, a cosmetology shop, et cetera. But tattooing and cosmetology cannot take place in a permanent cosmetology shop. So it's just kind of like, okay, tattooing and Cosmo are pretty broad. Permanent cosmetics is pretty specific. So you can do permanent cosmetology in different spaces, but you shouldn't be doing tattooing if you only have a permanent license. And also some updates that reflect what we do already, saying, hey, if you're moving locations, if you're going out on your own, if you're having more than one booth, you need to let us know where you are. Don't necessarily need to get a new license, but we might need to come out and inspect your location again to make sure that it still meets the regulatory standards. And again, we struck some anachronisms and unprofessional conduct standards there, specifically ones related to addiction to narcotics and habitual drunkenness. Those are covered in Title III. If you're incompetent to practice is really where we look at those spaces. And then the very last thing is electrologists, similar to estheticians, just clarifying that their laser authorities are limited for removal of hair and that they're not supposed to be practicing medicine. That's it. Any questions?
Questions from the committee? I think we'll have you stick around, Lauren.
Absolutely.
We'll dig into the language on the walkthrough with Mr. Devlin, and then if there are questions, we can have more of a discussion after the walkthrough. That sounds good.
Yeah.
Well, thank you for presenting layman.
So,
Layman's terms.
yeah.
Come on. I think we're all interested in especially learning more about the difference between permanent cosmetics and tattooing, but we'll all right, so Representative Waters Evans has to jump on some of us. Thank you much, Mr. Devlin, for being here.
Morning, Chair McCarthy. Morning, committee. Thank you for having me. For the record, my name is Tim Devlin, Legislative Counsel. And you should have access to both the draft committee bill, which is numbered 24-0288, draft 1.3, as well as a summary of that. And that will be the 3-page of condensed run through, including hyperlinks to the relevant statutes. If you'd like to pull those up to see the original language that's proposed to be modified by this bill. Chair McCarthy, would you like me to primarily work off the summary or do a line by line walkthrough of the bill itself?
I think at this stage, we can go through the bill summary, and if there are questions, we can dive into the bill language if there's something that jumps out at us. But I think at this point, we're trying to get a overall sense of what's in the draft.
Okay, that sounds good. And apologies if some of this sounds redundant. Attorney Lehman did a fantastic job of walking through most of this already. So this bill proposes to modify provisions relating to the Professional Regulatory Fee Fund, expand what constitutes professional misconduct to include impeding an inspection. It will modify the scope of practice for estheticians and clarification for their licensing. It will modify the placement of subchapter titles concerning nursing statutes and create consistency in terminology relating to nursing. It will create an exemption to osteopath licensing for students in clinical rotations. It will create an exemption to radiology technologist licensing for limited temporary medical licenses. It will modify aspects of tattooing, body piercing, and permanent cosmetic licensing, including the number of advisors, shop licensing, unprofessional conduct, and clarify the scope of practice for electrologists. So starting with part 1, which pertains to general provisions of the Office of Professional Regulations. This is sections 1 and 2. Section 1 will amend Title III BSA, section 127, unauthorized practice, so that funds derived from civil penalties for violations involving the unauthorized practice of regulated professions, which are deposited in the Professional Regulatory Fund, no longer need to be expended only on, quote, providing education and training for board members and advisor appointees, end quote. Section 2 will amend Title III, BSA section 129A, unprofessional conduct, to include impeding an investigation. It will constitute unprofessional conduct. I'll just pause there.
question on this section? I imagine on section one, our colleagues on Ways and Means will weigh in on the appropriate uses of that fund. I don't think we've ever really delved too much into the uses of the fund, but on section two, any questions, from anybody on this? Let's keep going.
Part two of the bill pertains to barbers and cosmetologists, and this is sections 3 through 8 of the bill. In general, these sections will amend statutes regulating barbering and cosmetology so that aesthetics and manicuring are included as well. Section 3 in particular will amend Title 26 BSA section of 271. This is definition section, and modify the definition of aesthetics and specifically excludes the sale of application of cosmetics to customers in retail stores or customers' homes, any practice, activity, or treatment that constitutes the practice of medicine, skipping a little bit, including injections of any substance and the use of lasers or application or permanent cosmetics. The definition of shop is also modified to be a facility or facilities regularly used to offer or provide barbering, cosmetology, aesthetics, or manicuring.
A question from Representative Hango?
Yeah, I don't remember this from Attorney Lehman's testimony, but this section that says it specifically excludes the sale or application of cosmetics to customers in retail stores or customers' homes. Does that mean you are proposing to, this bill proposes to exclude the sale of cosmetics in a, for instance, cosmetologist shop? Or the application in someone's home, like if they're getting ready for a wedding, for instance? What does this mean?
Sure, and I apologize, I'm just taking a moment to see if I described it incorrectly as includes or excludes in the bill here. That might have been a typo on my part. So I'm just checking over the original language in, let's see, this is section 3 now. And, okay.
Big.
See, so this is on page 3 at the bottom of the bill, and aesthetics means, so this is what distinct chairman thing.
So Lauren might be able to help us out of here.
That would be great.
It's the opposite, isn't it?
Yeah, so this is Lauren Lehman for the record of tracking. So what it does is it excludes from the scope of practice, applying makeup, so you don't need a license to apply makeup.
Yeah.
You'll see that there's also exemptions to the existing chapter, which is always a challenge with the PR bill. We don't have the context of the chapter that exempts from shop licensing, applying makeup in a theater, applying makeup for special events, applying makeup in your home. So this continues that exemption and says, hey, putting makeup on, selling cosmetics is not being an esthetician. You don't need a license.
Okay, so they can do it. They just don't need to be licensed for it. Okay, that's not really clear, I don't think. If a layperson is reading this, but
If a layperson can ever read the whole
Yeah.
RPR bill. That's okay. Yeah. We're here to make sure we're asking these questions though, and also referencing the full context. If it, I don't know if there's a way to get it Representative Hango's concern without pulling in the whole chapter, but maybe if there is context, then it's easier there when we see another draft.
maybe in your bill summary, you could just say
Exactly what I was saying.
they do not need to be licensed to perform these.
Okay.
And Representative Hango, I'd be happy to update the summary, so provide a sentence or two to get at that point there.
Yeah.
Lots of these.
Let's see, continuing in part 2 under barbering and cosmetology, we have section 4, which amends Title 26 BSA, section 272, prohibitions and offenses, so that a person may not practice aesthetics and manicuring without a license, like barbering or cosmetology. Similarly, a person cannot let this occur in their shop. Section 5 will amend Title 26 BSA, Section 276, General Powers and Duties of the Director, so that the director of OPR shall adopt rules for the sanitary and safe standards for shops and practice of aesthetics and manicuring without a license, like barbering or cosmetology. Section 6 will amend Title 26 VSA, Section 282, shop license, so that the practice of aesthetics and manicuring may only be permitted in a licensed shop like barbering and cosmetology. Section 7 will amend Title 26 VSA, Section 283, examination, so that licensing examinations may be in whatever form approved by the OPR director rather than necessarily be, quote, both practical demonstrations and written or oral tests, unquote. Section 8 amends Title 26 VSA, Section 284, issuance of license, so that shops offering aesthetics and manicuring that have paid their license fees, that have paid their fees and are in compliance with OPR rules shall be issued a license, again, like barbering or cosmetology shops. I'll pause there.
Questions on that section? All right, not seeing any hands.
Next part of the bill, part 3, pertains to nursing. Although it's just one section, section 9, this appears as though there's a lot more ink on the paper here in the bill, but really what it's doing is modifying the placement of a subchapter title. And so it's listing out much more of the chapter to kind of get at a drafting wise. It's just kind of a drafting core, which is why there's more to it here on the page. And in short, sections 1622 through sections 28 are moved from subchapter 4 for nursing assistants to subchapter 3, where we have pertain to registered nurses and practical nurses. And it will be clear that the statutes regarding licensure, examination, endorsement, and renewal apply to both registered nurses and practical nurses by drafting it this way. Section 9 also creates consistency in terminology by changing the active practice requirements to continued competency requirements. So the only modification of substance really is updating that term and then just moving the subchapter title. Okay. Part 4 of the bill is, has to do with osteopathy. This is just one section, section 10. And this amends Title 26 VSA, Section 1753 exemptions, so that enrolled osteopathy students may practice in supervised clinical training programs. Part 5 pertains to radiology, and this is sections 11 and 12. Section 11 amends Title 26 VSA, Section 2801 definitions, so that, quote, holders of limited temporary license to practice medicine, end quote, are included as regulated licensed radiology practitioners. Section 12 amends Title 26 VSA, Section 2803 exemptions, so that holders of limited temporary licenses to practice medicine are not prohibited from practicing radiology. The next part of the bill pertains to tattooists and body piercers. This is sections 13 through 17. In general, these sections will amend statutes regulating tattooing and body piercing so that permanent cosmetics are included as well. Section 13 will amend Title 26 VSA, Section 4101 definitions, and this will remove the definitions for disciplinary action and special panel, and will modify the definition of shop to include the practice of permanent cosmetics. And just a note here that administrative law officer could still take disciplinary action against a licensed electrologist or applicant pursuant to Title 3 or Title 6 elsewhere, specifically Title 3 VSA 129, and I believe Section Title 26 VSA Section 4411. The next section of the bill, 14, will amend Title 26 VSA Section 4104. That is Director of Function, Commissioner of Health and Rules, so the Director of OPR may adapt rules pertaining to tattooists and body piercers, apprenticeships, shops. Section 15, oh, yes.
No, I guess, going back a little bit to, subsection 9, I think it was 13, permanent cosmetics. What are examples of that?
I don't know if I'd be able to provide examples. I don't have the technical expertise on that subject.
And maybe for the record, sometimes it's a permanently tattooing eyebrows, lashes, eyeliner. It's usually,
Okay, but essentially.
yeah, it's less deep, there's some technical differences.
Okay.
And it's not permanent, it can fade like after 6 months, these dyes, it doesn't go as deep in the skin.
Gotcha. No, I totally know what you're talking about now.
Yeah.
Okay, thank you.
Just admit on that, your very first line, Tim, it's just a typo on permanent cosmetic fillers.
So was that the summary?
I'm sorry, under part 6, at the very top, it's a nitpick, but you have permanent versus.
Oh,
permanent.
thank you.
Not a biggie, but
Nope.
just saw that.
Absolutely make sure that's the correct term.
My big catch for the day.
Thank you very much.
Got it early too. Yeah, get out of the way.
Time for lunch.
Yeah.
All right, sorry.
The next section of the bill is 14 and, 15. And this will amend Title 26 VSA, Section 4104, advisor appointees, so that the Secretary of State will appoint 3 advisors, which shall include 1 licensed operator practicing tattooing, 1 licensed operator practicing body piercing, and 1 licensed operator practicing permanent cosmetics. Section 16 will amend Title 26 VSA, Section 4105, license requirements, so that the OPR director may adopt rules to require additional information to provide completion of an apprenticeship for tattooists, body piercers, and permanent cosmetologists. Subsection D is modified so that all shops shall designate a supervisor who is at least one of the professions being practiced in the shop, be it tattooing, body piercing, or permanent cosmetics, rather than a designee from each category. Subdivision D4 permits standalone licensed permanent cosmetic shops and cosmetology shops to practice permanent cosmetics. Subsection D6 requires shops to notify OPR of any location changes which may trigger a new inspection. Next section, Section 17, amends Title 26 VSA, Section 4108, unprofessional conduct. And this will remove from what constitutes unprofessional conduct, specifically addiction to narcotics, habitual drunkenness, or rendering professional services to a client if the operator is intoxicated or under the influence of drugs. It also removes subsection C regarding disciplinary action. Again, an administrative law officer could still take disciplinary action against a license pursuant to 26 VSA 4411 and 3 VSA Section 129.
Representative Hooper.
Thank you, Mr. Chair. Sorry, Tim,
Sure.
takes us a section to catch up with what you're. At this point, do shops require an inspection to open?
I'd have to double check.
Like a tattoo shop? So if they move, why is it may trigger an inspection?
In many of the regulations pertaining to, the shop and its facility are tied to the location, but not all. So if they move to a new location, will notify us, it may trigger a new inspection, so we'll send somebody out. We'll inspect the new place. It's may because I think, there might be some things that don't, they're moving next door or upstairs. It's not gonna necessarily trigger the inspection, because the fundamental, the regulatory standards are still assumed to be met. It gives us the authority to tailor that. It's consistent, I think it's consistent. With the current. So that's may undergo an inspection, and it's just tailored to whether the regulatory requirements have been shifted or.
Are those inspections, is it Department of Health involved with that, or is that specifically your office?
That's specifically over here.
Okay.
The next part of the bill pertains to electrologists, and this is section 18, which will amend Title 26 VSA, section 4402 definitions, changing the definition of electrology and clarifying that the use of lasers is to be used solely for the purpose of hair removal, excluding any practice, activity, or treatment that constitutes the practice of medicine, including injections and permanent cosmetics. Which brings us to the last part, the effective date in section 19, which states that this act shall take effect upon passage.
That was breezy. So I think since we have a little bit of time here, it might make sense to see committee, are there any kind of conceptual questions, things that didn't make sense, anything that jumped out or like, what are we talking about here? I think, yeah, we hit the permanent cosmetics one. I think that's a little unfamiliar to some of us.
I guess down in like the previous section, 17, the unprofessional conduct, the removal, I guess this is probably more of a question for Lauren, the removal of the language around habitual drunkenness and substance use on site, the rationale behind the removal of that.
Absolutely. Lauren Lehman, for the record, it's already covered in Title III. So the language here is a little, it's old, it's antiquated. And we already cover in Title III, and, for if you're incompetent to practice for any reason, physical, mental health, et cetera, then it's unprofessional conduct.
So it's just redundant to another area that already covers this.
Thank you.
And Tim, were the references that you have in the summary, are those the statutes that sort of cover this and where there was the redundancy?
The the references to where administrative law officer can still take disciplinary action, those ones?
Yes.
I believe so. And I can check with Attorney Lehman to make sure I'm referring to what I believe is actually used by OPR. Sounds like it was 1003 actually under 3 VSA, perhaps it has something different here. I can update the summary accordingly if that's not the accurate citation, but that's my interpretation of the law.
Yeah, I think that I feel confident and we'll just want to check with the committee that if we take this language out, that it's covered elsewhere in statute. But just for reference, in case anybody asks us, especially whoever's reporting this bill on the floor, where is this covered, being able to say, yes, it is in this title, in this chapter, in this subsection.
Deemed to be redundant.
Yeah.
Title III.
Yep, we
Thank you,
definitely don't want to give the appearance to the public that we were allowing.
Loosening the
Yeah,
standard.
that we were loosening the standards in any way. That's exactly
It's just a free for all tattoo.
Right.
Not what we're doing here. Okay.
I'm glad we can laugh at this type of subject.
Look, sorry, Representative Waters.
Thank you. I'm wondering, the section about the apprenticeships, I was wondering if that's an issue in other situations where there's an apprenticeship situation, and if so, like, is there language for that elsewhere or is this something that's?
I think one of the reasons we don't have language elsewhere. We haven't seen it in other industries. We have recommended it. So mental health has a supervised practice component for most of those licenses. We're doing a mental health study right now to look at our licensing study right now to look at best practices that other states use to kind of also bolster some protections in those spaces. There's also an apprenticeship in funeral and in barber and cosmetology. We haven't seen those abuses there, but I think this is a good opportunity for us to look at best practices in other states and to develop some protections around it that then we can use for those other professions as well.
Any other questions at this point for Tim or Lauren? Are there any other things, Lauren, that might come up? Are there any other, boards that have recommendations or things that you're working on that we might just think about the timeline for our work on this bill?
So I know that there's a number of standalone bills out there, where they request to incorporate them into the NPR bill. We have no strong opinions on those. So I know House Health Care has been considering for support providers. We've also been talking to Senator Care about doulas. So I'm not sure how that all wraps into this process, but those are the only things
Do you want to bring up 606 now while we have a little time?
Yes, just very briefly, that's another one that has been brought up as potential addition to this bill, that would expand access to certification for people that have, don't have citizenship, but have the skills and could potentially help our workforce a little bit.
Yeah, if you want to do the quick intro on that, when we bring, kind of do the next OPR discussion. So, if your office, Lauren, could take a look at 606 and weigh in on that for sometime like next week.
I believe if you're open to it, we have looked at it. I think Tim offered me the first look at the language, or a look at the language. Is this consistent with the California law that allows to use social security numbers?
I don't know for sure, but I do think it's modeled on a couple other places. Sure, I know.
Happy to offer testimony there.
I just want to clarify, are you thinking of combining the bills that are in healthcare and the one Rep. Nugent just mentioned with this particular bill?
So at this point, I just want to make sure that anything that's in OPR's umbrella that we kind of have on the radar, I'm not making any specific suggestion about combining bills. I think it may be the most efficient thing for the work of the clerk's office and us reporting on the floor. If there's consensus around things, to just go ahead and have one OPR bill on the floor so that we don't have multiples. If we work through this language over the next week or two and get to a place where, we all feel supportive of this language with these policies that are in the bill, we hear an introduction to walkthrough and some testimony on 606. I think the committee could decide together whether it makes sense to include additional policy into one committee proposal, even if it's coming from another bill. If the healthcare committee wants to refer us the peer support bill, we might put those all together, although that could just stay completely separate. So at this point, I want to leave this open and let the committee kind of decide. I wouldn't want to put anything in the housekeeping bill that the committee feels, strongly, or there are folks on the committee that feel like they don't want to support. So
I just would like to be very clear that I think a housekeeping bill is a housekeeping bill, and to add new policy to cover previously unregulated topics or topics that aren't in statute already, I think that's too much in a housekeeping bill. So I just wanted to put that out there. Like, this is great the way it is because we're just clarifying and updating. And it's probably a very simple and easy bill to pass. But when you start adding all kinds of new policy to something, I think that belongs in a bill on its own.
So would peer support fit into that?
I don't think so, because it's adding a new profession, correct? I mean, it's something we have never regulated before.
Yes.
From my very limited understanding of that bill, and I've only very briefly heard about it.
I don't have any problem with just leaving it as a separate bill. And if the healthcare moves it forward, then we'll either take a look at it officially as a drive-by, or we'll take possession of it. That seems to be the best way for us to look at the pieces that pertain to our jurisdiction. But yeah, I don't have any problem keeping it separate. So
Thank you.
All right. Don't think there's anything else we need to do on this morning. I did want to make sure that we understood that the idea with the permanent cosmetics is that they could happen outside of a tattooing shop that was licensed. But the tattooing can't happen in a place that's only been allowed to do the permanent cosmetics. Am I understanding that correctly?
Yes, so the permanent cosmetics can now, right now, happen in cosmo shops or tattooing shops, and they started to kind of go independent. So we are very clear that if you go independent, you shouldn't be doing cosmetology or tattooing without a tattooing license. The laws already allow permanent cosmetics to happen in those two shops, but don't allow permanent cosmetics to do that full brand.
So you said be pretty straightforward. So committee, I know I have a couple things that I would love to catch up on. So if there aren't any more questions on the initial OPR bill, I'd like to go ahead and take a little bit of a longer break. And we'll come back for the testimony on the miscellaneous ethics language at 10:45, which we're scheduled to hear from General Counsel and the administration's feedback on that. So now we'll adjourn and go off live and be back here at 10:45.